Hi, it's Dr. Leslie Hawkins, board certified OBGYN, and today I'm going to go through 5 questions that I think are so important to ask your OB provider at your first prenatal visit. So let's get right into it. Question number 1 is, what is my actual due date? Estimated due date is determined by the first ultrasound done after the fetus measures more than 7 weeks and 0 days gestation by size. So going by the last menstrual period is often not accurate. Ultrasound is much more accurate, particularly if you've had a first trimester ultrasound. So knowing your due date is really important. And what I recommend is that if you're using an app to track your pregnancy, that you go in and enter that due date once you've confirmed it with your OB provider. Because if when you first started using the app, you were using the date of your last menstrual period, your app could be off in terms of how many weeks you are. So I have a lot of patients who come to me and they are not on track with the number of weeks that I think they are. So it's important to be on the same page with your provider and to confirm what your actual due date is. If a first trimester ultrasound is not available, sometimes we use a second trimester ultrasound, although that's less accurate. Or if IVF was involved in becoming pregnant, sometimes we use the dates of the embryo, knowing exactly how many days old that embryo was and the date that it was implanted. So there are different ways to determine the due date, and in sharing what you've had done and the results with your provider, they can determine for you what your most accurate estimated due date is. And just a reminder that your due date is when you reach the 40 weeks of gestational age. That means that you could deliver earlier or later than that day, just depends on how the pregnancy goes. Second question I recommend you ask is, where will I be delivering? It is sometimes difficult to sort out where your provider delivers. So where I work in Toronto, us OBs, we deliver at one hospital. So if you're registered to me, you would deliver at my hospital, Humber River Hospital. It's important to know exactly where that is and where you're going to be registered to deliver. Sometimes our offices are not inside the hospital like mine. It's just down the street. And so it's important to know exactly where your OB provider is working and delivering. And speaking to that, you may be someone who doesn't even have an OBGYN, but you have another form of OB provider. And so for me, where I work, that could be a family physician who has a specialty in obstetrics, and they would also deliver at a hospital. So it's important to know what hospital that is. And thirdly, the other option for prenatal care where I live is midwifery. And so it's important to have a great conversation with your midwife about where you're going to deliver. And where I work, those options would include home, birthing center, or hospital. And some midwives deliver at more than one hospital and some just one. So having that conversation with your provider is super important so that you know off the bat where to go, what to expect, and make sure that you've been referred to the person who you want to be seeing, who works at the hospital you want to be delivering at, or the location you want to be delivering at. Question number 3 is, who will deliver me? Well, that's a great question. Where I work, all of the obstetricians work in a group practice, which means that we share the patients when we're on call. So that means that I would take call, we call it, or I would be on duty for deliveries, say 2 or 3 times a month, and on that day I stay at the hospital and I deliver all of my colleagues' patients. So when you go into labor, if you're my patient, it may or may not be me who's there when you're in labor. And other practice models work differently. So a lot of family medicine OBs may have this type of model, or they may come in for all of their patients because perhaps they carry a lighter patient load than we would. And so that it's not as big of a burden on your work-life balance to come in for all of your patients. Midwives, for example, often work in a team of 2 or 3 midwives, and one of them is always on call, so that the midwife who's going to deliver you is likely somebody that you've met before along the way in your clinic visits. So there's lots of different models. All of them are great. It's important to know so that you know what to expect when you go in. Number 4, what are my options for genetic screening? I recommend that you ask this so that you know what's available to you. This will depend on where you live, what's available, and your own risk factors, including your age and problems that have happened in previous pregnancies, or that are happening in the current pregnancy. When we talk about genetic screening options, we're just talking about various tests and ultrasounds that could look for a genetic problem in the baby. Some patients also choose not to do any of this testing. So it's just helpful to ask, hey, what are my options at this point? And your OB provider can go through that with you. Last question, number 5, which I encourage every patient to ask their provider, is what are my risk factors in this pregnancy? This helps to just guide you so that you have a good understanding of whether you're having a low-risk pregnancy or whether your pregnancy is at risk for one reason or the other. Using generalized terms like low risk and high risk can be a bit inaccurate sometimes, because sometimes patients are having a fairly healthy pregnancy, but they do have a risk factor or something comes up in their pregnancy that their OB provider is going to be watching out for. Labeling somebody high risk doesn't really have a strict definition. So it's hard to use those terms, but just asking, hey, what are my risk factors in this pregnancy? Is there anything you're concerned about to your OB provider? That can be super helpful because they might identify things that you haven't thought of. Like, for example, you may be someone who's living with diabetes. And for us, that's a risk factor in pregnancy because it can lead to a higher risk of certain outcomes in the pregnancy, and that means that we're going to watch you more carefully. You're going to have more frequent ultrasounds and more frequent fetal monitoring, for example. So those are important things to ask when you're meeting your OB provider for the first time. I hope that helps, and I hope that you use these questions in your first visit with your OB provider. If you are pregnant, congratulations. If you enjoy this type of content and want to learn more about OBGYN and obstetrics care or antenatal care in general, pregnancy and delivery, you come to the right place. So join me, and I'm happy to help educate during your journey. I'll see you next time.